What if your blood pressure medication is working, but at the wrong time? You might take the correct drug at the correct dose every single day, yet still have limited protection during the hours when your heart and arteries are under the greatest stress. If you take your pill at 8 in the morning, many medications reach their strongest effect several hours later. But your cardiovascular system often experiences a sharp rise in blood pressure shortly after waking. Doctors call this the morning blood pressure surge. This does not mean everyone should immediately move their medication to bedtime. Timing depends on the drug, your blood pressure pattern, kidney function, fall risk, and other conditions. Never change it without speaking to your doctor. So ask yourself, is your medication protecting you during the hours when you personally need it most? Blood pressure is not a fixed number. It follows a 24-hour biological rhythm. During healthy, restful sleep, blood pressure usually decreases by about 10 to 20%. This normal nighttime reduction is called nocturnal dipping. The heart works less, blood vessels relax, and the nervous system becomes less active. As morning approaches, hormones like cortisol and adrenaline increase. Your heart rate and blood pressure rise, blood vessels become more active, platelets may become more likely to stick together, and the clotting system becomes more responsive. This circadian response helps you wake and become active. But in older adults, especially those with hypertension, diabetes, sleep apnea, kidney disease, or arterial stiffness, the morning rise can be larger and more dangerous. Research shows heart attacks and strokes occur more frequently in the morning. That's why doctors look not just at average blood pressure, but at when it rises, when it falls, and how much it changes. A normal reading in the doctor's office does not always reveal the full picture. Imagine your blood pressure is measured at 10:30 in the morning when your medication is already active. The reading looks excellent, so everyone assumes your pressure is controlled. But what was it at 5:30 a.m.? What happened when you stood up? Was it dangerously low during the night? Did it rise sharply before your morning dose started working? An office measurement cannot answer those questions. That is where 24-hour ambulatory blood pressure monitoring can be valuable. A small device measures your pressure repeatedly while you go about your day and while you sleep. It can identify morning hypertension, excessive nighttime drops, nighttime hypertension, and abnormal dipping patterns. Some people are non-dippers. Their blood pressure does not fall by the expected amount during sleep. Others are reverse dippers, meaning their pressure may actually increase at night. Many patients do not know they have these patterns because checks usually happen only during daytime appointments. For a non-dipper, nighttime blood pressure may remain elevated even when daytime readings look normal. For another patient, taking medication at night could lower pressure too much during sleep and increase dizziness or fall risk. This is exactly why there is no universal rule to take blood pressure medication at bedtime. The correct timing must be individualized. Consider an older patient who takes 2 medications every morning. His daytime readings are excellent, but he repeatedly becomes dizzy when getting out of bed. A 24-hour monitor may show his pressure becomes too low during the night, followed by a rapid rise after waking. Another patient may show acceptable daytime pressure but persistently high nighttime readings. Both have hypertension, but they do not need the same treatment schedule. Another concern in older adults is orthostatic hypotension. This happens when blood pressure falls significantly after standing, commonly defined as a drop of at least 20 millimeters of mercury systolic or 10 diastolic within several minutes. It can cause dizziness, blurred vision, weakness, instability, or falls. The cause may be medication, dehydration, autonomic dysfunction, prolonged bed rest, or another condition. Dizziness after standing should not be dismissed as just aging. You can give your doctor more useful information by measuring your blood pressure strategically. For 3 consecutive days, your clinician may ask you to record readings at specific times. First, measure in the morning after waking, following at least 5 minutes of quiet rest and before taking your medication, unless told otherwise. Second, if safe, repeat the reading after standing for about 1 to 3 minutes. Have someone nearby if you have a history of dizziness or falls.